Welcome to AHVC Heart Channel, a podcast that explores the wonders of the human heart. I'm your host, Joseph. Today in this episode, we have Dr. Cliff Wong here with us to share about cardiac screening and what you need to know. And we are very excited to learn more from you. Welcome, Dr. Cliff.
Hi, Joseph and audience. I'm Dr. Cliff Wong here, a cardiologist in Asian Heart and Vascular Center.
Okay, Dr. Cliff, recently I've heard from my friends and relatives that some people in their 40s suddenly have heart attack or they actually need to do balloon and stent. Actually, what test can you actually recommend me?
Joseph, it depends on what you are looking for, and also depends whether you have any symptoms of chest pain or breathless. And important is actually whether you have any risk factor profiles such as high sugar, high cholesterol level, cigarette smoking, and even family history of heart disease.
I thought that blood tests and ECG should be enough.
Honestly, according to the literature, the sensitivity of diagnosing coronary artery disease using conventional ECG is about 70% only. This is a very good example to explain about this. My patient came to the emergency department for chest pain, and the first ECG was done when the chest pain has subsided already, which looked entirely normal. However, when the chest pain come back again, the repeated ECG become very, very abnormal. And in which case, we did the coronary angiogram, which confirmed a severe blockages in his heart vessels. So for the blood test, usually during the health screening, we'll do the cholesterol level and also the sugar level. Some of the health screening package, they may increase what we call high sensitivity CRP, which is a marker to use to estimate the risk of heart disease in the patients. However, in a lot of cases, we have a lot of patients actually, the sugar level is normal, the cholesterol level even is normal, they don't have any history of smoking, any family history of heart disease, they still have severe heart vessel blockages. So all these blood tests may not be very good to indicate your risk of heart vessel disease. One more thing is actually for the HSCRP, although we say this is a marker for the risk for your heart disease, but this one, the sensitivity and the specificity mean the accuracy is about 60% only. If the CRP level is normal or indicate you are low risk for heart disease, you still have 40% chance you may have a heart disease, which this is the design and this is the limitation of the test.
Then how about treadmill tests?
What you mean is a treadmill stress ECG test, right?
Yes, correct.
First of all, you need to know treadmill test is actually designed to detect severe or significant heart vessel blockages only. So if you have minor or moderate heart vessel blockages, your treadmill test will still be normal. Moreover, the sensitivity and specificity of the treadmill test is about 70%. Okay, in a simple term, it means the accuracy is only about 70%. That means if your treadmill is normal or what we call negative, there is still 30% chance you may have severe or significant heart vessel blockages.
It doesn't sound very accurate to me.
Yes, Joseph. However, we can improve the accuracy by doing stress echocardiogram, in which case we'll do the ultrasound scan, echocardiogram of the heart before and after the treadmill. This can increase the accuracy to about 85%, but this is still aimed to detect severe or significant heart vessel blockages. And when we look at the heart directly using ultrasound, its by right should be more accurate.
The test that you mentioned, actually, how long do all these things take and what should I expect?
Usually for the stress echo or even treadmill test, we ask the patient to run at least 7 to 9 minutes. Okay, however, if you can run longer and faster, definitely the test will be better and more accurate. What we aim to do is ask you to run until you can achieve a heart rate, which is target according to your age and gender.
What happens if I did not manage to run through the whole session or I have motion sickness while running the treadmill?
Actually, we always have alternatives, okay? If you cannot run on a treadmill, sometimes we can ask you to just ride on the bicycle or exercise on what we call stationary bike. In medical term, it's called ergometer. If you really cannot exercise at all, we can use the medicine to stress your heart to mimicking the exercise.
I also heard about my friend going for calcium scoring. Could you share more about this?
Actually, a calcium scoring is a CT scan that looks at how much calcium is in your heart vessel. So a build-up of the calcium can narrow the arteries and reduce the blood flow to the heart. A calcium score may have to show the arteries disease before you have any symptoms. And important is actually the calcium score can help to determine the risk whether you have a stroke or have a heart attack in the future.
Does that mean that I can choose either stress echocardiogram or calcium scoring to determine my heart health?
Joseph, remember we have just discussed, right? All these stress tests are aimed to detect severe or significant heart vessel blockages. And calcium score can be normal or even zero, even though there's a heart vessel blockages. So we may miss the diagnosis of minor or moderate blockages if we just do the calcium score or stress echo or even just a treadmill test.
But Dr. Cliff, why do I need to know whether I have minor or moderate heart vessel blockage?
Joseph, remember, prevention is always better than cure, and this is what our government is trying to promote now, called the primary prevention. Severe heart vessel blockages can cause the chest pain, breathlessness, and heart attack. However, a lot of heart attack actually is caused by minor or moderate heart vessel blockages. More important is that there has been a lot of research and literatures to recommend many measures of different primary prevention for people with just minor or moderate heart vessel blockages, and which can significantly decrease the chance of heart attack and the progress of heart vessel blockages.
Oh, I see. Now I understood more. Thank you, Dr. Cliff.
Joseph and the audience, remember, it is important to consult a doctor to arrange the most suitable and tailor-made check of your heart and body.
That brings us to the end of today's episode of AHVC Heart Channel. I hope you found our conversation with Dr. Cliff Wong as informative as I did. Heart health is a topic that cannot be emphasized enough, and we are very grateful to have the opportunity today. If you enjoyed today's episode, please don't forget to share this episode with your loved ones. Stay tuned for the next episode. Thank you, Dr. Cliff.
Thank you.